Ralph and Adam, everybody, and thank you very much for joining us right here on Wake Up Worcester on Charter TV3. And remember, if your friends missed this important show at 6 and 8 a.m., be sure and tell them that they can check it out under community programming on Charter On Demand. Worcester City Manager Mike O'Brien with us. Thank you very much for coming by.
My pleasure, Hank.
And also a very distinguished panel with us today. John O'Brien, the President and CEO of UMass Memorial Healthcare. Thank you for being with us.
My pleasure.
And from Vanguard Health Systems, the Vice President, Dennis Irish. Thank you for being here.
Glad to be here, Hank.
Mr. Manager, these are the co-chairs of your task force on public health. Tell us a little bit about why you decided to convene this task force on public health and what has come from it.
Well, Hank, let's start off with that. From a public health perspective, the city of Worcester has always been on the cutting edge. Going back to the late 1800s, when our population was growing, gangbusters, industrial revolution, immigrant groups coming from all over, we were ahead of the curve when it came to dealing with the challenges of a growing population, infectious disease, other public health issues that arose. And from that proud tradition, obviously, through the years, continued so with tuberculosis and then the Spanish flu, not only the issues of growing population, but new and emerging threats. And then fast forward to today, the work of Dr. Morse and Derek Brindisi in public health, working with the staff and the community. We're continuing that work, and then we faced some of the great challenges throughout the nation, certainly reflective here in Worcester, the budget. And what had to be made were tough choices. Public health suffered. But at the same time, there was those in the community that said we should look very carefully at what the future holds for public health, bring the best around the table to look at best practices and other aspects of public health and what we should and shouldn't be doing, and then begin to carve out a mission that's sustainable going forward, that talks about rebuilding from those difficult cuts and setting a tone for the future. Those that I was able to speak with at the time was John O'Brien, here to my left, as well as Dennis Irish, and with many others from our community, including the med school and then professionals throughout the community, brought the best around the table, a task force, and started looking at all those issues. And eventually, after a great deal of work under extreme pressure, this talented group came forward with a document that's comprehensive in its view, it's very thorough in its analysis, and gives us a real guidebook going forward to making sure that the tradition of public health continues, that it is sustainable from a financial modeling standpoint, staff and otherwise, and then makes the very best of the community, because we're so blessed in our community from a healthcare system perspective with UMass Memorial and St. V's and Great Brook Valley Health Center and Family Health Center, and then beyond with all of our other providers. How do we use that network? How do we use those strengths and carve out a mission that brings all those forward to help us make sure we stay
So, Mr. Manager, was this really part then of reinventing government? I mean, had Worcester, do you feel, kind of fallen behind that curve that you described dating all the way back to the late 1800s? Because of the budget concerns, were we not giving the health care that we were used to in the city?
No, I wouldn't say that. I'd say that when challenges rise like this, so do opportunities. And it was that kinetic opportunity where we sat down, talked amongst ourselves, and realized from the ashes, from these difficult cuts, had to come a new way of doing business, reinventing government. And quite frankly, when you look at whether it's the business world or look at life in general, it's adapt or die. And we had to look at the ways we were going to do this that would make sure that we had the tools in place, the people and the resources to be sure that our community is not only protected from infectious disease or potential outbreaks like H1N1, but go beyond that to look at what are the things that are going to affect us from a quality of life and a public health perspective, that with the right focus and right partners on the table, we can begin to turn and make them a positive. Because if we don't act, we could end up with a real challenge, both from a health perspective and cost perspective down the road.
So when you sat down and were sitting at first with the group for the task force, how did you approach it? I mean, what overall was it that you wanted to accomplish? I mean, did you sit down and say, listen, we're going to have, our pie is going to be this much money, and this is how we're going to work, or was it more, this is the challenges and we'll make the money work later?
Well, I benefited, Hank, from the fact that I actually served as the Public Health Commissioner for the City of Cambridge for 7 or 8 years. And so I had a real familiarity with the task going forward. I think that working with Dennis and working with many representatives of the community, it has really been a true pleasure. And I think that we really devised the plan with the input of a lot of people. We had about 30 people at the table. Sustainability, obviously, is an important consideration, but we didn't let that hamper the work. We were looking for the long term. The city manager indicated to us that he wanted to have the very best public health capability in the country and look at what what's going on out there, We worked with the National Association of County and City Health Officials and surveyed similar communities to the city of Worcester. It had a lot of input from a lot of people. Sustainability was an important thing, but mostly we looked at best practices.
So Dennis, you really weren't looking for some kind of quick fix. I mean,
no,
this is
not
for
at
the
all.
long haul.
No, and the manager did not say clearly that the diminution in the availability of resources affected the reorganization that is anticipated. But frankly, I don't want to say we had a blank check, but the manager did say, we want to build a state-of-the-art Department of Public Health in the city of Worcester. Now, how do we go about doing that in recognizing the economic climate in which we find ourselves? And we proceeded accordingly. As John mentioned, we did look at best practices around the country, and we adopted some peer communities to compare ourselves to, and we were very careful to identify those communities of similar size that also had a medical school located, because we have, in addition to two fine clinical healthcare systems, we're privileged to have the University of Massachusetts Medical School here in the city. So
I wouldn't think
Albany and New Haven were two other communities.
How many communities could there be? But those are two then, Albany and New Haven.
We looked at Ann Arbor, Michigan,
yeah,
and looked at several other premier public health departments. And I think having the school at the table, Dr. Michael Collins, the chancellor, was on our executive committee, was actively involved, and he had several of his staff that were very active with us, and including Dr. Katerina Kiefe, who's the head of the new Quantitative Health Sciences division within the medical school itself. And one of the most encouraging things was that not only did we have robust energy by everyone, but everyone wants to stay at the table. You know, we know that the city cannot do this alone. It's going to really take a village. It's going to take the entire community. Resources are going to be limited for the foreseeable future. But as Dennis and I both know, healthcare is also changing. We're going to start shifting away from a pure medical model dealing with illness to really start focusing on the health of the community and the quality of life in the community. And that was a lot of the focus of the work over the course of the past 6 months.
And we'll hear about that straight ahead, but I think what is so exciting about what we're hearing this morning is that you began with this very optimistic outlook. You know, as you said, some tough circumstances, but out of those tough circumstances, you're going to move forward with something that is sustainable and something that's going to be a model for other communities in the future as well. And we'll be talking about what they have come up with straight ahead right here on Wake Up Worcester.